Itu kan ngoài rồi, sao không phải Queen di sân gọi, không ăn Queen trong rồi. Jadi punya satu kalau bukan. Mana tapi sudah lagi pun boleh bro.
Hang dokter yang deh sih. Hang nak marat kan nak marat. Jadi aku nggak merira ini. Kota kita lagi tu.
Tahu ya. Stroke tu dah. Stroke tu dah nanti.
Mit aku kau reka. Nanti kau reka. Mit aku di.
Jadi orang lain yang ada.
Tani ya weh.
Tani ya weh. Ada lebih kulit lagi.
Pipi kulit saya tu numia mancar ke isi kotor kereta. Jadi laki.
Aku jadi dia membuka. Bukan tu beli barang kanan orang saya siap beli lagi.
Jadi mari cuba.
Mari cuba.
Take this one, take three. Take the ball, take that ball. Làm cái câu ấy đó. Ra cả đủ cái chân này. Tu bay đây chứ, chị bay đây chứ, chúng khar khar này, chúng bay được cái gì? Chỉ là this walking chat cũng làm cho nó walking chat và Singapore ngầm ở đây đông cao thì đông hả? Nuôi một con sao nào rồi? Đi nuôi một con massage xong rồi phấn được cái gì? Bên đây là cái điện thoại vừa đó có.
Saya situ naik memang
Euro เท่าไหร่อ่ะ
And this is very important and related to the prevailing situation in Manipur. So I would like to appeal to the various doctors and other organizations like the TARAGI CHEISHU to continue to organize such medical free camp and try to reach out all the nooks and corners of the Naga areas and other communities area. Because this free medical camp is very meaningful to keep in touch with the other communities. But as in the hill area, there is a very lack of medical and facilities. But in the valley, all these facilities are available. So today, TARAGI CHEISHU is sponsoring the free medical care. This is very helpful to present, prevailing situation in Manipur. And if we continue to conduct such medical free camp in the days to come, I think this can be very helpful to restore the normalcy and peace in the state of Manipur. So this is very, touching to the hearts, to the people of, different sections. So today, this Irong village and the STM high school students and more than 7, 8, 9, 10 villages surrounding here, the patients are kept and, it's going on well. So this is very good, and this is, it's very significant that we are one and we love each other. So if we can continue such free medical care in the days to come, I think regarding the prevailing situation, 70-80%, can subside or control through this medical free medical care or outreach program.
님의 장난에 그랬다. 그 지금 이 가리를 또 이제 아유님 망이 브레스토로 사부 군인이 먹방 사부 군인이 생각해서 뭐 상도로 akan bahamra
Di kemana itu không ham gì ini hari tak ada bah jadi kami tak jadi macam hidup nak
jadi kumham ya lo ya bro
Today, we are organizing, we from TARAGI CHEISHU are organizing a outreach program in a village, in a place of Tangkhul habitat. Here, most of the villages surrounding are habitated by Tangkhuls, and some are Maltese and Maltese families. And there were some villages from the Maltese also. Our TARAGI CHEISHU's aim is, in the TARAGI CHEISHU, we believe in service and humanitarian services and sacrifice. We are coming from different professions, especially medical professionals, engineering, then lecturers, university professors, then scientists, and from the legal field, advocates, judges, retired judges, and judges also who are practicing. And all these professionals are collected together to form a TARAGI CHEISHU. Our aim is to do some service for the people, and today we are very happy to get the chance to serve a place far away from the center of Yairipok and mainly habitated by its Tangkhul people. We were invited by the South Tangkhul Naga Association, and here we are organizing a health camp in a school run by the same practice association, and we are bringing all the medical specialties from RIMS, JENIMS, and seizure hospital. All these are members of the TARAGI CHEISHU, and whatever free medicines we are bringing, we are not taking any donation from others till now. We are donating from ourselves, by our members. Our funds are donated by members only. And we are planning to do many outreach programs, and we are scheduling every week one outreach program. And we have already started since last month, and we are going to do many social services, especially to uplift Manipur, to bring out a new Manipur. And we also believe in coexistence in between all these tribes together in Manipur. And unified and new developed Manipur is our vision and mission. And we are trying to make a mission, and we are planning for a new Manipur. We have got a vision of 2050. And by 2050, we want to make Manipur a developed state in the northeast part of India. And we want all the Meitei and other tribes, intellectuals from them to come together, come together hand in hand to do some service for the state, so that we can coexist together in a developed state. This is our aim.
Can you believe that this outreach program is a path to bring normalcy in the state of Manipur?
You see, most important thing is there is a sort of trust deficit among different tribes. The main reason may be that we are having some language gaps. Like, say, for example, most of the tribes, they know some Manipuri, but for us, they know Meitei language, but we don't know the tribe language. This is a big mistake from our part. So we are, from the TARAGI CHEISHU, we are trying to make certain programs so that we can learn their language, and they can also learn the Meitei language, so that the interaction should be at the grassroots level, at the village level, at the far-flung areas, between men to men, not by politics or not by religions, and we should not be separated by religions. As such, TARAGI CHEISHU is a religious organization. We are non-religious organization. We don't believe in the religion dividing our people from one to another. At the same time, we are apolitical. We don't believe in any political concept or any political party. And we also don't encourage anyone to stand for elections from our TARAGI CHEISHU. Rather, we tell them to voluntarily opt away from our membership, so that we want it to be completely neutral and thinking only about the people of Manipur. Because most of the people in the far-flung areas here also we are finding, most of them are very innocent and they are gullible. They can be easily trapped by some rhetorics. And we have been finding a lot of rhetorics from the beginning. Say even we are divided by the place where we have been staying. For example, Tsingtam, it's a hill valley. One is a little higher, another one is geographically a little lower region. This doesn't qualify to differentiate, divide amongst us. So this should be removed. And the only thing is that we don't need anybody else. We need our own understanding, cooperation amongst ourselves. We don't want anybody's intervention here, whether it is from outside or inside. We don't want any intervention. We want the complete understanding and interaction in between the different tribes. So we are going to make different programs in this direction, so that there will be development of more understanding, so that we can go hand in hand to develop this state, to make it into a very developing state, and later on our aim is to make it developed by the turn of the middle of the century, so that by then we can live with our necks, with our heads raised. Okay, now up till now we are just like a beggar state. We are funded almost more than 90% by the central government. We should stop this. We should try to develop economically, and it needs peaceful coexistence. If there is no peace, there will be no development. So peace should be there. Without peace, there will be no development. So first, peace should be there, and we are working in that direction. We want people to be living in a peaceful environment. That is the only way that we can achieve some development. That's what I feel. That is what we have in the TARAGI CHEISHU. Our feelings is like.
May I know your name?
My name is Dr. Dhakeshwar Singh Prachangam. I am the professor and head of ENT department in genetics, and I'm working as a convener of TARAGI CHEISHU, which is an organization made by all the intellectuals in our state.
Thank you.
시 ꯃꯊꯛꯇ ꯍꯦꯟ ꯅꯨꯡꯉꯥꯏꯁꯤꯅ ꯑꯣꯐꯤꯁ ꯍꯦꯗꯀ꯭ꯋꯥꯔꯇꯔꯅꯦꯕ ꯁꯤ ꯑꯩꯈꯣꯏ ꯑꯗꯨꯗ ꯀꯥꯔ ꯂꯥꯛꯄꯅꯦ ꯑꯗꯨꯗꯤ ꯂꯣꯏꯅ ꯎꯔꯦ ꯖꯒꯥꯁꯦ ꯐꯖꯩ
Southern Tangkhul Naga Baptist Association and Khangariba Naga se egi pusida ahan balak sebani masida uriba surrounding leiba pegi school di status di Oda Singh Chhatra Singh Managing Committee aduga masi pegi Taragi Cheishu haina pegi inong nong sanggar pa look amaga nusi chanana Maitai khangde Tangkhul khangde Naga khangde aduga pegi Muslim khangde punna minata ba yade haidana yamna maru iba kem ama sigi stan ba haiba daga Irong sida sindi base yamna maru iba medical kem amani masida pegi film gi kai kumnada iba mayama senengira le aduga rims tagi nasab naiba Dr. Suraj aduga pai Jennings tagi thake pai gajen pai myam se ana tagi asuru naba ke mase pai wada kasana habi rakpadagi sinji aina pai arrange taw le jabani masida apai gi college gi dawda ya da thab khara ai lo sinjarmaga masi yamna maru eba important game ne la jabani game masi important eba se masi game sina tani madudi aikoi punji na daba yade yelo moi gi lemir kwai kwai mitai gi Naga gi Tangkhul gi Kabui gi pena na pai musalman khangde prab se हिंगमिनदब यादे अदुगा हक्चांग से फदब यादे यामना मरुति हेल्थ सिनो क्वाइगी मरुनी खनबा चैनबा अमा लेजसनु अदुबु अखोइगी लेरिबा इखनलिबा छात्र सिंगी लेकाई से लेबिरिबा लमदम से लेबिरिबा अखोइगी जात खुदिमकी मिल खुदिमसे खरदम ओरसु अखोइगी तारागी चैशुना सपोर्ट तौजगे हैना ngasi अदुमबा सिजबा केममनी अदुना ने हैना साइगी केमसी यामना मरु ओइबा केमम याइजबसे अनि सुबदा अइना जगह सिदा तसरिबसे अइगी हनकी इरान को मतुंगा मेगी तारीख अहुंगी मतुंगा अइ क्वाक्तारे तसरुरे अइगी टीमजिगन मेनना अरगी सवल मांगे तसरुरे मसिगी सिना अहुं सुबा केमनी मसिना फैना तोबंगम्बा कार्डियोलॉजी की ओइरो अदुगा सरू की ओइरो हार्ट की ओइरो कोकी निंगो की ओइरो मिट नाकोंगी ओइरो मेडिसिन की ओइरो नमजबा हिदारंग खरा फैना खाइना जल्ला गुजरपनी मसिदगेना चावबा केममु फै प्लान तौजगे मयामना हाबिरपा कोइदा डिमांड तौबिरपि मतुमिना लोइनना स्कूल असी अइना खंगरे मदुदी सरकार की केनम फंगना मयामना खजिनरगा अंगंगम होनरगा फोगलदिबा छात्र छात्री सिंगु कोइगी पिलर होइना फ्यूचर पिलर होइना सेबिरबसि यामना मरु ओइबा पोट अमनी अदुगा कोई असाना ताकि बदमाइना मथंग का लाकदबो मतमदा कोई स्कूल असिगी अपग्रेड तौबा कंस्ट्रक्शन तौबो मतमदा अइना अइगी साइटगी अइगी जिंगा बंदल मंगा 5 बंदल तो जिंगा अइना अइगी साइटगी तौजगे नॉट एज ए डायरेक्टर जेनिम्स की डायरेक्टर अमा होइना नतबा अइगी साइटगी सुमसे गुदोंग चाबो मयाम से हाइबदी अइगी नमजबा खरदु अखोइगी होगलबा सात्रसिंदा थंजौजनु अदुगा अइगुंबा अयाम थोबिनरकानेदा अपुनमना कोइ पावर शक्ति सागलकनी हाइबा वफमदुगी पानमनन इंग साइजबसे अना मतंग एनी कॉलेज की स्कूल की थबक तंदा अइगु सुनिसिंग दिरागा बातोन तोबिरो अदुगा अइगी टेलीफोन नंबर से अदुम जेनिम्स की है ना वेबसाइट हांगो तंदा ऑल ओवर इंडिया दा अदुम लोइनमा अइ नंबर से कांटेक्ट तोबु यागनी अदुगा लोइलननना अइगी मरु असार सुम लइबनी अवना अरोइबदा हाइजिनिंग बदे अखोइगी स्कूल की टीम मैनेजिंग कमिटी नत्रगा अखोइगी असांगना हाबिरपा कसाना हाबिरपा एनी छात्र सिंहे खुदों सादबा मतमदा ट्रीटमेंट की दमो तबो मतमदा जेनिम सब खपिरपा तारगदी फ्री ऑफ कॉस्ट ता अखोना लायंग जगनी हाबसे एनी आई कर भैरगा मैं मुंकन खुरमजरी कुनो उठागसरी थैंक यू
अदु अइना तसिनवा एक्चुअली मफमस्टल लापसी अइगुदी फर्स्ट टाइम माय लाइफ अदु अइ कराइले ये खुदी with Taragi CHEISHU की अनुपा संग डायरेक्टर दिवा डॉक्टर सिंह about maya ayam sima yamna pili yamna thajaba ulai sina I actors sing is manipulated riba balwa actors sing I need to fraternity ki sina I put from we have problem sa doctor mayamna I be kadege we last bedi masih thana pe few times student agomanta dikita ngasi mapagdala iyang nuwaiba amada actually amtala ba actually school se school itu what idea am sibawa berarti asmaina private school ne ba school si lain na sung imphal di private school si building sa ko pa phajaba yam masala yam dei adu yam costly hoy ngang si like phajna tamali pasya sangna which the land you are not kita it is kusida ayam si lai kusida in the pain many I have the government school line private school ne hai adu yam nuai wan si sa sing su sing ma ka da ba kam se ai life ki yam nuai dai aru ai dai la apni asal ay asal kasasi ay ana dige kumagal pani mahal islam mahal ay ba pati ꯑꯁꯤꯒꯨꯝꯕ ꯃꯦꯗꯤꯀꯦꯜ ꯀꯦꯝ ꯑꯃ ꯁꯤꯜꯂꯤ ꯍꯥꯏꯕ ꯇꯥꯕꯗ ꯑꯩ ꯌꯥꯝ ꯅꯨꯡꯉꯥꯏ ꯉꯥꯏꯒꯤ ꯃꯤꯡꯁꯤ ꯃꯌꯥꯝꯅ ꯈꯪꯕꯤꯔꯛꯄꯅꯤ ꯑꯩꯒꯤ ꯑꯁꯦꯡꯕ ꯃꯃꯤꯡ ꯑꯩꯒꯤ ꯁꯔꯅꯦꯝ ꯍꯥꯏꯔꯤꯕ ꯇꯈꯦꯜꯂꯝꯕꯝ ꯂꯣꯀꯦꯟꯗ꯭ꯔ ꯑꯗꯨ ꯃꯌꯥꯝꯅ ꯐꯤꯜꯝꯗ ꯂꯣꯀꯦꯟ ꯍꯥꯏꯔꯦ ꯈꯪꯉꯤ ꯑꯩꯍꯥꯛꯁꯤ ꯃꯅꯤꯄꯨꯔꯗ ꯂꯩꯕ ꯐꯤꯜꯝ ꯑꯦꯛꯇꯔꯁꯤꯡꯒꯤ ꯑꯦꯁꯣꯁꯤꯌꯦꯁꯟ ꯒꯤꯜ ꯑꯃ ꯂꯩ ꯁꯤꯅꯦ ꯑꯦꯛꯇꯔꯁ ꯒꯤꯜ ꯃꯅꯤꯄꯨꯔ ꯍꯥꯏꯗꯅ ꯑꯗꯨꯒꯤ ꯄ꯭ꯔꯁꯤꯗꯦꯟ ꯑꯣꯏꯔꯕꯅꯤ ꯅꯥꯏꯟꯗꯒꯤ ꯄ꯭ꯔꯁꯤꯗꯦꯟ ꯑꯣꯏꯅ ꯂꯩꯔꯦ ꯑꯗꯨꯒ ꯑꯩꯁꯤ ꯐꯤꯂꯝ ꯄꯥꯝꯖꯕꯅꯤꯅ ꯐꯤꯂꯝꯁꯤꯗꯒꯤ ꯃꯅꯤꯄꯨꯔꯤ ꯐꯤꯂꯝꯗꯤ ꯃꯌꯥꯝ ꯅꯨꯡꯁꯤꯗꯅ ꯌꯦꯡꯕꯤꯕ ꯑꯩꯈꯣꯏꯒꯤ ꯏꯝꯐꯥꯜꯗ ꯂꯩꯕ ꯚꯦꯂꯤꯗ ꯂꯩꯔꯤꯕ ꯑꯩꯈꯣꯏꯒꯤ ꯇꯝꯄꯥꯛꯀꯤ ꯃꯩꯇꯩ ꯏꯆꯤꯜ ꯏꯅꯥꯎꯁꯤꯡ ꯅꯠꯇꯅ ꯑꯣꯜ ꯂꯩꯔꯤꯕ ꯄꯨꯝꯅꯃꯛꯅ ꯅꯨꯡꯁꯤꯕꯤꯗ ꯃꯅꯤꯄꯨꯔ ꯐꯤꯂꯝꯁꯤ ꯌꯦꯡꯕꯤꯕꯁꯦ ꯑꯩꯈꯣꯏꯒꯤ ꯑꯗꯨꯛꯀꯤ ꯃꯇꯤꯛ ꯅꯨꯡꯉꯥꯏꯖꯩ ꯑꯗꯨꯛꯀꯤ ꯃꯇꯤꯛ ꯄꯦꯟꯖꯩ ꯃꯔꯝꯗꯤ ꯌꯦꯡꯕꯤꯅꯕ ꯂꯩꯇ꯭ꯔꯒꯗꯤ ꯑꯩꯈꯣꯏꯅ ꯍꯣꯠꯅꯖꯔꯤꯕ ꯑꯩꯅ ꯄꯥꯝꯖꯔꯤꯕ ꯑꯥꯔꯠꯁꯤ ꯇꯥꯗꯅ ꯂꯩꯒꯅꯤꯀꯣ ꯑꯗꯨꯅ ꯃꯌꯥꯝ ꯄꯨꯝꯅꯃꯛꯅ ꯃꯅꯤꯄꯨꯔꯤ ꯐꯤꯂꯝ ꯍꯥꯏꯕꯗꯤ ꯃꯩꯇꯩ ꯐꯤꯂꯝ ꯍꯥꯏꯇꯥꯔꯦ ꯃꯁꯤ ꯅꯨꯡꯁꯤꯕꯤꯌꯨ ꯑꯗꯨ ꯃꯅꯤꯄꯨꯔꯤ ꯐꯤꯂꯝ ꯑꯥꯔꯠ ꯑꯁꯤ ꯑꯩꯈꯣꯏ ꯃꯅꯤꯄꯨꯔꯗ ꯅꯨꯡꯁꯤꯗꯅꯕ ꯌꯣꯛꯈꯠꯄꯗ ꯃꯌꯥꯝꯒꯤ ꯃꯇꯦꯡ ꯄꯥꯡꯕꯤꯌꯨ ꯍꯥꯏꯕꯗꯨ ꯍꯥꯏꯖꯒꯦ ꯑꯗꯨꯒ ꯃꯁꯤꯗ ꯀꯔꯤꯒꯨꯝꯕ ꯑꯩꯈꯣꯏꯒꯤ ꯑꯦꯔꯤꯌꯥꯁꯤꯒꯤ ꯏꯔꯣꯡꯁꯤꯒꯤ ꯑꯗꯨꯒ ꯀꯔꯤꯒꯨꯝꯕ ꯑꯩꯈꯣꯏꯒꯤ ꯐꯤꯂꯝ ꯑꯦꯛꯇꯔꯁꯤꯡꯗ ꯐꯤꯂꯝ ꯐꯦꯃꯤꯂꯤꯒꯤ ꯃꯦꯝꯕꯔꯁꯤꯡꯗ ꯀꯔꯤꯒꯨꯝꯕ ꯇꯧꯍꯟꯅꯤꯡꯕ ꯊꯕꯛ ꯂꯩꯔꯒꯗꯤ ꯑꯩꯈꯣꯏꯗ ꯄꯥꯎ ꯄꯤꯕꯤꯔꯛꯎ ꯑꯩꯒꯤ ꯐꯣꯟ ꯅꯝꯕꯔ ꯑꯗꯒꯤ ꯐꯤꯂꯝ ꯐꯣꯟꯒꯤ ꯆꯤꯌꯔꯃꯦꯟꯒꯤ ꯅꯝꯕꯔ ꯑꯩꯈꯣꯏꯒꯤ ꯑꯦꯛꯁ ꯆꯤꯌꯔꯃꯦꯟ ꯑꯩꯈꯣꯏꯒꯤ ꯍꯥꯟꯅꯒꯤ ꯃꯥꯁꯨ ꯌꯥꯎꯕꯤꯔꯤ ꯑꯦꯛꯇꯔ ꯑꯃ ꯑꯦꯛꯇꯔꯁꯤꯡꯁꯦ ꯑꯌꯥꯝꯕ ꯆꯠꯀꯅꯤ ꯑꯗꯨ ꯑꯩꯈꯣꯏꯅ ꯊꯣꯛꯍꯧꯗꯅ ꯃꯐꯝ ꯊꯣꯡꯕꯅꯤꯅ ꯑꯦꯛꯇꯔꯁꯤ ꯇꯣꯉꯥꯟ ꯇꯣꯉꯥꯟꯕ ꯀꯣꯛꯅ ꯆꯠꯈ꯭ꯔꯦ ꯕꯣꯅꯤ ꯆꯠꯈ꯭ꯔꯦ ꯁꯔꯥꯗ ꯆꯠꯈ꯭ꯔꯦ ꯍꯥꯏꯗꯦꯠꯅ ꯑꯩꯈꯣꯏ ꯑꯅꯧꯕ ꯑꯉꯥꯡ ꯂꯩꯕꯒ ꯗꯦꯅꯤꯁꯀꯁꯤꯡ ꯑꯁꯤ ꯑꯩꯈꯣꯏ ꯆꯠꯄꯁꯤꯗ ꯂꯥꯛꯆꯒꯅꯤ ꯑꯗꯨ ꯅꯨꯄꯤ ꯐꯤꯃꯦꯜ ꯃꯦꯝꯕꯔꯁꯤꯡ ꯌꯥꯎꯒꯗꯕꯅꯤ ꯑꯗꯣ ꯑꯩꯈꯣꯏꯅ ꯅꯨꯄꯤꯁꯤꯡꯒꯤ ꯄ꯭ꯔꯣꯕ꯭ꯂꯦꯝ ꯈꯔ ꯂꯩꯕꯗꯒꯤ ꯈꯤꯇꯪ ꯅꯛꯄ ꯖꯒꯥꯗ ꯑꯣꯏꯅ ꯌꯥꯎꯕꯅ ꯐꯕ꯭ꯔꯥ ꯍꯥꯏꯅ ꯑꯩꯈꯣꯏ ꯉꯁꯤꯗꯤ ꯚꯦꯔꯤ ꯁꯣꯔꯤ ꯅꯦꯛꯁ ꯇꯥꯏꯝ ꯀꯔꯤꯒꯨꯝꯕ ꯈꯨꯗꯣꯡꯆꯥꯕ ꯂꯩꯔꯒꯗꯤ ꯑꯦꯛꯇꯔꯁꯤꯡꯅ ꯀꯔꯤ ꯇꯧꯕ ꯌꯥꯕꯒꯦ ꯍꯥꯏꯕꯗꯣ ꯑꯩꯈꯣꯏꯅ ꯍꯥꯏꯕꯤꯔꯛꯑꯣ ꯑꯩꯈꯣꯏ ꯃꯇꯦꯡ ꯄꯥꯡꯖꯒꯦ ꯐꯤꯂꯝ ꯀꯥꯞꯁꯤꯔꯥ ꯃꯌꯥꯝꯁꯤ ꯅꯨꯡꯉꯥꯏꯅꯕ ꯀꯔꯤ ꯇꯧꯁꯤꯒꯦ ꯍꯥꯏꯕꯗꯣ ꯔꯦꯗꯤ ꯑꯩꯈꯣꯏ ꯃꯇꯦꯡ ꯄꯥꯡꯖꯒꯦ ꯑꯗꯨꯒ ꯑꯩꯈꯣꯏꯒꯤ ꯇꯔꯥꯒꯤ ꯆꯩꯁꯨ ꯍꯥꯏꯕ ꯑꯣꯔꯒꯅꯥꯏꯖꯦꯁꯟꯁꯤ ꯑꯩꯈꯣꯏꯅ ꯌꯥꯝ ꯔꯦꯁꯄꯦꯛ ꯇꯧꯖꯕ ꯌꯥꯝꯅ ꯃꯔꯨꯑꯣꯏꯅ ꯈꯟꯖꯕꯅꯤꯅ ꯇꯔꯥꯒꯤ